myself. Just like nobody around me understands it. Nobody wants to hear you complain about it all day long. Nobody even wants to deal with it. It's like, and then when you got seen so many doctors and so many oral surgeons, and everybody just wants to scapegoat it to my so-called sinus condition, and but I just know there's something wrong. And the more paperwork I have, and the more stuff I bring to doctors, it just made me kind of feel a little crazy. But you want to get fixed. You want this gone. You want your life back. And so I dealt with it for 2 years, and then I got an email from an old blog I posted from eHealth Forum, and then I came across a support group called Ben's Friends, which is for a bunch of different rare medical conditions, and it's really a great thing. If you type in living with and any kind of mental condition you might have, it's almost like a Facebook for people with that condition, and we all talk about what we're doing to make it better, what doctors we're seeing, our surgeries coming up. It's really great. And seeing that just motivated me to just go back and try to get fixed again. I went to another ENT, a more well-known one. Well, the one who took out the styloid process sent me to another ENT, and I saw him, and I just talked him into taking another CAT scan, pretty much, which showed that was 2 years. That was about 4 months ago, and I just felt like I was going down the same road. The guy was saying maybe I should try the trigger point injections, which I also tried. I don't know if I mentioned that. Where it's pretty much they shoot you in different areas. I have one right here, one on the back of the head, one on the back of the throat for these conditions called Eagle syndrome, spinatus capitis syndrome, and temporal tendinitis, because they all kind of mimic TMJ, and they all have the same kind of symptoms. And they shoot this Novocaine into you, and if it numbs the agent out, if it numbs your pain, then they know that's where the problem is, and they move on from there, doing different steps. Spent about $1,000 doing that. Was really excited. I felt like I was onto something, and I was gonna get fixed. And it's just feeling like the end of this was coming close. Did all that, it didn't work. So I'm just like on Ben's Friends, looking for answers. Nobody really has answers on there. Everybody just kind of has their story, and when you're not getting the help from a medical professional person, it seems to me like they need somebody who just specializes in this. But you figure between all the people I saw, it would have been a lot easier for me. So I saw a post somebody posted about glossopharyngeal neuralgia, which is a compression right at the base of your skull of your cranial nerves. You have, I guess, about 12 of them, and if a blood vessel or an artery is pressing up against them, it's kind of like a short circuit, like it's pinching the hose. So when the hose branches out to all the areas that it connects to and controls, it's not sending the right kind of signals. So I went with that because I want to get fixed. I went and luckily saw a great brain surgeon in Newport Beach. His name's Christopher Duma. He didn't make me feel like I was crazy. He took an MRI. It showed up. I went in there asking him to check for this, and it showed up. And after 12, maybe 13 years now of dealing with this, it's hasn't been easy. Like, everything's just been crazy. Like, it's hard to control my moods. It's hard to even talk right anymore. It's just like I'm constantly having to repeat myself to people. It's hard to focus. I've kept my job, which I do construction, because you can't just lay in bed. You want to, but you just can't. I have a son. He's actually like 14 now, and he really motivated me not to give up. and not just sit there, because I need to take care of him. I need to make sure he's all right. So at this point, I've had the stylo process taken out 2010. If you can kind of see it, there's like a scar running down right here. I've had my tonsils taken out. I've had my adenoids taken out. I've tried prolotherapy. I've had trigger point injections. I've tried like everything I possibly can. And then I've had a lot of the same procedures done over and over again. Blood work for no reason. The scope stuck down my nose for no reason. Finally, this Dr. Duma is telling me that it showed up on the brain MRI that I have a compression, just like what I went in there to ask him to find. And I'm fucking thankful. So what's going on now? It's Saturday today, December 8th. Monday morning I'm having brain surgery. And what they're going to do is they're going to pop open the back of my skull right here, go in, move the artery that they saw in the MRI off of the nerve, facial nerve, which is supposed to decompress it since it's being compressed. Teflon cotton balls are like Teflon shreds around the artery. I mean, maybe it's around the nerve, but it's pretty much like putting a pillow there, so it's not being compressed. I really can't wait. I'm really actually pretty excited about this because I've been living with it for a long time. No one could really understand it. It's just insane. It's really insane. And I found out on Google too that it's dubbed the suicide disease because after about 3 years of living with it, a lot of people end up killing themselves. And in fact, about 50% do. So many where the doctors will actually refer to it as a suicide disease. And that just hasn't been an option for me. I mean, you think about it, you get depressed, nobody understands you, even whoever you're dating, whoever you're with, your family, they can't understand what you're feeling. And you can't complain about it every single day, even though it never goes away. But, so Monday morning I'm having this brain surgery done, and I'm really excited about it. I'm hoping that this is the thing that finally fixes me, and that's why I'm posting this video on here, because I'm hoping somebody else with Eagle syndrome, somebody else who maybe thinks they have Eagle syndrome, it could help guide them, because as I talked about earlier, I went in with the panoramic, and if the wrong doctor doesn't know what he's looking for, even though he tells you he's looking for eagles, if he doesn't order that CT scan and looks at it in a three-dimensional image, then he's really just going to send you in circles like I kind of was sent with. I just want to post this video for people that think they had it, maybe got knocked down like I did, just to keep trying. And I'm posting this video for people that had their styloid removed and probably felt like I did, like you did whatever you could, you just gotta live with what's left, or live with what's there, which we shouldn't have to do, because this shit really sucks, and it's not going away, and knowing it's not ever gonna go away sucks, and it just eats you up. It's really changed like my personality, my emotions, like as you could just imagine after being sick for that long. So, posting this video, and Christopher Duma's gonna YouTube my surgery. I noticed he had done it before, as I was just kind of scrolling the internet trying to find out as much information as I can. So I'm posting this video now, and I'm going to post another one after my surgery, and I'm hoping this works. Between how knowledgeable this doctor seems, and the brain MRI, and finally, I'm just hoping this works. It's gotta work. If not, I'm gonna try something else. But anyways, I'll be posting back after surgery, and I'll also be posting my surgery just in hopes to help people so they're not in the situation I've been in for the last 12 years, because it's a messed up situation. I mean, there's a lot of bad diseases out there, but it's the only way to really explain it is like having a tooth right before it needs can't even think right now. It's like having a tooth right before it needs a root canal. That throbbing pain feeling, that where you have no choice, you got to go in there, you got to get this fixed because it's just too painful. Except nobody could see it, and nobody understands it, and doctors keep telling you you're fine, and you're like pointing at this tooth that's bad, that you feel is bad, but they're telling you that tooth's fine. It's just insane. But hopefully this video helps somebody out, and I'll be posted back once I get everything fixed up. Hopefully. Alright, take care.